All right. If Medicare poses the biggest risk to financial solvency, what can the federal government do to address the issue?
The federal government can use lots of big levers that it has at its disposal. Medicare is one of them. It has to basically reform Medicare, make Medicare more modern. It has to look at some of the federal health plans that it actually gives now to workers and try to get as much efficiency out of those plan designs as they can. There's roughly about $1 trillion in the current budget that the federal government controls directly on the provision of health care, which also includes the Veterans Administration and the Department of Defense. Every one of those things should be optimized to basically work the right way. So what's an example of that? If Medicare were, example, to pay their claims with, say, less errors and other components of what they were doing, that might have a very real chance of actually reducing costs. But you can go one step further. You could actually use that information to actually figure out what the quality of care is in as close to real time as you possibly could. We should harness those resources, and the federal government has the market power to do that if they put out the right procurement contracts.